नमस्कार, मैं हूँ अशोक व्यास। भारत से आते हुए हमने कई बार ये सुना है कि मानव सेवा माधव सेवा है और उसमें जो फिजिशियंस होते हैं, जो चिकित्सक होते हैं, उनका तो धर्म ही सेवा करना है और फिजिशियंस मिलकर जब एक सेवा के लिए समर्पित प्रकल्प बनाते हैं हिंदू फिजिशियंस इंटरनेशनल, तो क्या चिंतन है उसके पीछे, क्या विचार हैं, जानेंगे सेक्रेटरी एचपीआई के डॉक्टर राकेश शर्मा जी से। नमस्ते डॉक्टर साहब, वेलकम।
नमस्कार व्यास जी।
तो आप ये बताइए, इतने सक्रिय आप रहते हैं कई कई संगठनों में भी और अपने कार्य में भी, तो हिंदू फिजिशियंस इंटरनेशनल की विचार कैसे आया?
जी हाँ। तो कुछ डॉक्टर जो हम भारत से आए हैं, यहाँ पे कई सालों से रह रहे हैं, प्रैक्टिस कर रहे हैं, तो हमने सोचा कि दुनिया में कई ऐसे ऑर्गेनाइजेशंस हैं जो अ, अच्छा काम करते हैं मेडिकल प्रोफेशन में। कई हैं ज्यूइश हैं ऑर्गेनाइजेशंस, कुछ क्रिश्चियन ऑर्गेनाइजेशंस हैं, और उसमें हमने सोचा कि हमारी कोई हिंदू के नाम से कोई ऐसी मेडिकल ऑर्गेनाइजेशन नहीं है जो इंटरनेशनल लेवल पे काम करती हो। तो ये आइडिया लास्ट ईयर आया हम दो डॉक्टर्स को, एक क्लीवलैंड ओहायो में रहते हैं और एक मैं न्यूयॉर्क में हूँ। तो हम दोनों ने मिलके ये फैसला लिया कि हम एक ऐसी ऑर्गेनाइजेशन बनाते हैं जो गरीब लोगों के लिए मेडिकल फील्ड के अंदर काम करे। जैसे डॉक्टर्स विदाउट बॉर्डर्स का प्रिंसिपल है, उसी प्रिंसिपल पे हम चलेंगे, लेकिन हम किसी इमरजेंसी में सिर्फ काम नहीं करेंगे। हम दुनिया में जहाँ पे गरीब देश हैं या गरीब लोग हैं, उनको अगर मेडिकल हेल्प नहीं मिलती, वहां जाके हम उनको मेडिकल हेल्प दें। तो इस हिसाब से हमने लास्ट ईयर एक ऑर्गेनाइजेशन तैयार की। हम यूएसए में 5 डॉक्टर्स हैं जो इसके फाउंडिंग मेंबर्स हैं। एक क्लीवलैंड में है, एक ओहायो में एक और सिटी से है, एक नॉर्थ कैरोलिना से, एक टेक्सास से, और एक आखिर में मैं हूं न्यूयॉर्क से। हम पांचों ने इसको तय किया और इसका नाम हमने रखा हिंदू फिजिशियंस इंटरनेशनल। ये एक इंटरनेशनल लेवल पे ऑर्गेनाइजेशन है जिसमें भारत के कई डॉक्टर हैं और हमारे यूएसए के डॉक्टर्स हैं, कुछ यूके के हैं, और हमारा जो एम है वो जितने भी इंडिया या इंडियन ओरिजिन के डॉक्टर हैं उन सबको मिला के एक इंटरनेशनल ऑर्गेनाइजेशन बनाई जाए जो गरीब लोगों के लिए काम करे, और इसी विचार से हमने ये हिंदू फिजिशियन इंटरनेशनल बनाई।
Very good. So, Dr. now switching slightly to English for some of our viewers, and the vision as they can read, but why don't you read the vision for your Hindu Physicians International?
Our vision is to spread happiness, wellness, and good health worldwide in the spirit of Vasudhaiva Kutumbakam without any artificial barriers.
तो ये वसुधैव कुटुंबकम की जो भावना है, उसमें मनुष्य मात्र के लिए आप सेवा करना चाहते हैं। एंड आई विल आल्सो शेयर व्हाट यू हैव displayed on your website, that is Together We Can, and please read further.
जी हाँ। तो हमारी ऑर्गेनाइजेशन के वेबसाइट है, उसमें हमने सारी इंफॉर्मेशन दी है। उसमें एक चीज जो है, टुगेदर वी कैन ट्रांसफॉर्म द ग्लोबल कम्युनिटी with dedicated and innovative medical and healthcare solutions in the spirit of seva.
तो एक और बात जो आपकी वेबसाइट से उठाई गई है वो ये है कि ये फेथ बेस्ड चैरिटी है ऑफ धार्मिक ओरिजिन टू सर्व द एंटायर ह्यूमैनिटी, एंड this is a self-governing board of directors with 5 members, as you mentioned. The question, Dr. Sharma, is there are, as you mentioned, about Doctors Without Borders, and of course, there are some agencies of United Nations, and there are few organizations which are working parallel to what you aspire to do through HPI. It it takes a lot of resources. Is the one question that I have in mind, because you have, let's say, if something happens somewhere and they need n number of items, in addition to having the presence of physicians. So how are you working to have that kind of a reserve with HPI?
Yes. So five of us have put our own money in this organization initially. So with the help of that money, we have made a website. We have created 501c. That means tax exempt in New York State as well as with federal government. So we don't have to pay any tax. Anyone who pays either dues or charity, for that person or corporation, any money they donate will be tax deductible. And this is a non-profit organization that is meant to help poor people, regardless of their race, religion, or nation. That's number one. Number two, this is called Hindu Physicians International. The Hindu word is a very broad term for us, for all of us who come from Bharat. Hindu means all the religions that started in India. So whether you're Sanatan Dharam person or Jain person or Buddhist or Sikh, all these four are under the banner of Hindus. So people who belong to any of these religions can be part of this organization, whether you're a doctor, nurse, or a technician, because we will need all these kind of different professionals to work under one banner. And of course, when we work, we are not going to look at the race or religion or the nation. It will be on humanitarian grounds, irregard or without any regard to their race or religion. So we will be open to serve any human being. And regarding the funds, we are hoping that after we put some money in, there will be plenty of other physicians who are going to donate money, and the corporations that are willing to help us, so that we can go and help poor communities or poor nations that lack medical help.
Okay, so let me put it differently. The nation need not be poor, but there will be poor people in all the nations. So, and there will be need of seva or service. Let's say you look at the situation as is developing right now in the war zones. They will need a lot of medical help in near future. Once things settle down, I don't know whether you are equipped to have somebody say go to Israel or to Palestine, or for that matter towards Ukraine. So those kind of areas are also a part of your consideration or not?
Actually, at this point, we are not designed to help any war victims, because our idea is to help people who are poor, who lack medical help. So I don't think we are equipped to go to any war zone. I'll be very honest.
Yeah. So let's look at the need of, let's say there are many free eye camps which are being organized in several interior parts of India or maybe South Africa, or so. Do you have a group of doctors who are familiar with the kind of needs that people may have? And if I may ask, forgive me for asking that way, but anyone from your team have the experience like those who are serving in Doctors Without Borders type of organizations?
Yes. Some of us have worked as a volunteer in different parts of the world, in one way or the other. So there are some members who are from Caribbean islands. They have worked there. I have a very good friend who's a surgeon in New York. He frequently goes to Jamaica, and he does some surgeries there. I know another person who goes to some other part in Caribbean and performs surgeries there. I know ophthalmologists who go and perform free cataract surgeries. So I think there's ample opportunity, whether you look at South America or Africa or poor parts of India where one can go and help those communities that lack medical help. And uh, that's a target. We are planning to go to certain parts of the world for a week or two at a time in a team of doctors, nurses, and technicians, and do as much as we can.
Wonderful. And now, as you have a formal launch for this HPI, what are you expecting is likely to be composition of that launching event?
Yes, so we are very happy that we have decided to inaugurate our Hindu Physicians International, or HPI, uh, on this coming Saturday, that's October 14th, in Manhattan. So we have rented a place, expect a few doctors from tri-state area and our founding members from other states to come there and have a program so that we can spread this information to other physicians who are like-minded. And sure, I don't expect 35-year-old person to devote more time, but some of us who are 55, 60, 65 and have some time to devote on for charitable purposes, and I do expect that those doctors will come forward, become members, and membership is absolutely free. So our inauguration is going to be on Saturday, October 14th, in Manhattan. We have a program from 11 a.m. to till 3 p.m. with lunch and some slides and the message that we want to provide to the community, and hoping that this first step of the ladder takes us to the next step and next step, and this will evolve over the next few years and will expand.
Okay, so now we switch gears from HPI to general awareness about leading a healthy lifestyle and taking the advantage of your expertise. The tips that you may offer for people in the times that we live. And if I may begin by asking you something which is not directly related to a physician like you, but do you see the kind of turmoil which is surrounding us and which is coming through different news items? It it draws you into it, and there is more stress in people. There are more reasons to worry about what will happen, etc. Does it affect our health overall?
Absolutely. Actually, the president of HPI is a psychiatrist. He is a graduate of All India Institute of Medical Sciences, and his name is Dr. Adityanji. He's the president and a good psychiatrist based in Cleveland. So, medical profession or our health is not just giving medicines or vaccine or doing blood tests. I think the psychiatric part is equally important, as there are people in the world that do need help with depression, anxiety, and other issues. And our emphasis is to do what we call the well-being of the person, not to just treat a disease, but prevention, as well as uh, emotional support also.
So I guess down the line you will come up with different models, modules, so to say. Maybe there'll be some telephonic service where people who are sort of on the edge of depression, etc., can call. I'm just thinking loudly. There could be several ways in which you can extend help. But now coming back to mental health issue, which is the key focus of America, India, and several other countries, and looks like there's going to be growing need towards mental health. Uh, on that front, do you see HPI focusing on certain awareness-oriented campaign?
You're absolutely right, Mr. Vyas, that as I said, medical profession is an evolving field. We used to put more emphasis on other diseases that we could diagnose with the blood test and whatnot. But now I think psychiatric or mental health issue is equally important, and I am glad that our president is a psychiatrist by profession. So this is one of the issues that we are going to take care of, and hopefully there are other physicians who will join us, and we can definitely do much more than what we have envisioned right now. So as we expand, as we gain more experience, I think we are going to evolve into different directions, both physical medicine as well as mental medicine.
So now, since there are most of the physicians from Indian origin, do you foresee a timeline that probably you will have plans in the coming year that these are the major activities which will be undertaken under the umbrella of HPI? Anything that comes to your mind about which you guys might have discussed so far?
Yes, we have already thought about it, about different projects that we have in our mind. Um, I have focused on South America first. I think countries like Guyana, Suriname, and Peru might need help. So we are planning to target South America first. And then, of course, there are a lot of communities in India that also require our help, and we plan to go there too. And just to add a little bit, there are things like defibrillators that are real lifesavers. So when we go to different places, I think we will also donate defibrillators, teach people who have some medical knowledge how to use them. Because as we all understand, if someone is having heart attack or arrhythmia and there's a defibrillator nearby, you can really save lives. So it's not just going there and working for a week, but also giving them certain equipment or so that we can change their lifestyle and increase their chances of living.
Let's focus on one particular disease which is growing, and that I would say is diabetes. There are different kind of reasons for people to become diabetic, and then you know more. But as a layman, what I hear is if you are diabetic, then it affects different organs gradually if you don't attend to it properly, etc. Considering that and remembering that prevention is better than cure, so any tip that you may share for someone who may be on the edge, or they what are the precautions that one should take?
Yes. I think people who live in urban areas are very well aware of a lot of preventive measures, whether it's diabetes or hypertension or heart disease. But in poor neighborhoods or poor nations, this thing is lacking. And so we will also have some printed material wherever we go. We will give them things like education on diabetes, high blood pressure, cataract, and obesity, or good nutrition, preventing malnutrition. These kind of things we are planning to make small booklets. So wherever we go, we will give them that information. I think that is going to be very, very important.
And for our viewers, any tip that you from your area would like to extend?
I What I would suggest to all the people who are in medical profession, please come forward, join us. And this is a non-profit organization. There is no self-interest of anyone. This is purely on volunteer basis to help people, irrespective of what race or religion they belong to. Yes, under the name of Hindu Physicians International. And I would also request other physicians and non physicians to please donate money. And of course, everything is going to be transparent. Uh, this is our website is going to put money that someone donates and where it is being spent, and I promise that this is going to be a wonderful thing for future. And I hope that our children who are born in this country will also join and make us proud that their parents who came to US or UK or Canada gave a good education to their children and good culture so that they help poor people anywhere in the world.
So, looking at my question, you responded and encouraged physicians to join, but some tip for those who are not from the physicians fraternity to uh, take themselves away from getting into diabetes. Any preventive measures that one should take?
Sure, yeah. I think what we will do, we will also arrange lectures. So, of course, all these lectures or talks are free or will be free. We can
No, no,
all
right now, right now, right now, what can you tell?
right now, the number one thing is diet, exercise, and don't gain weight. And that's my best tip. Overeating is bad, whether it's to prevent diabetes or heart disease or high blood pressure. Obesity, of course, is rampant in United States or Western world and is spreading to India too. Uh, so I think diet is extremely important, and I won't shy away without saying that exercise is ultra important. Plenty of studies have shown if you exercise 3 to 4 times a week, you can prevent lots of diseases. And there was one study done about 30 years ago called UKPDS study for diabetes, where they showed someone who has slightly high blood sugar, if those people watch their diet and exercise and don't gain weight, they will do better than the group that won't follow this advice but just will take a tablet. So it's better not to take a tablet but prevent diabetes with lifestyle changes.
Wonderful. So the advice will make us all dynamic, more dynamic than what we are, and I think Dr. Rakesh Sharma is also dynamic with the reference of being active. Last question: there are several organizations of physicians like API, and there could be few more. Do you foresee a sort of a synergy down the line where you collaborate with other organizations?
Absolutely. Ours is going to be an international organization. As you know, API is in US, and API has a different chapters of New York or Long Island or Atlanta and so on. We are going to be international based organization, and API, yes, they will be joining us, or their members will join us this coming Saturday. I'm hoping that lots of doctors from API will come and join us. There's no competition, by the way. It's not a parallel organization like API. So we are totally different, and API has a role to play among doctors, and there's no competition. We like API. I'm a lifelong member of API, and API doctors will come this Saturday, and they are going to be our members. One
Wonderful.
other thing I want to mention before we leave, our membership is totally free. You can go on the site that is hinduphysiciansinternational.com, and there's an application form. You can fill the application on the website and become a member of HPI. No membership fee. You can help us either by donating money or by working with us. You don't have to be a doctor. As I said, you could be an echo technician, you could be a nurse, because when we go and help someone in a poor community, You just don't need doctors only, you need nurses, technicians, and of course, if you want to help us and you are not in medical profession, please come along, because when we go somewhere, we will also need other helps, like someone who will arrange, someone who will make the program. So there's
So,
plenty of
on that note, looking at the time, I once again thank you for conceiving of this idea of Hindu Physicians International, and anyone who works to serve also works in resonance with what Swami Vivekananda said about Bharat. त्याग और सेवा हमारे राष्ट्रीय आदर्श हैं. So the national ideal of Bharat Mata being sacrificed in service, and you are living up to that in your own way. And I wish lots of good luck for the endeavors undertaken by HPI. Dr. Rakesh Sharma, Secretary of HPI, thank you
yeah.
very much for joining us. And together we recollect that Sarve Bhavantu Sukhina, Sarve Santu Niramaya.
Mr. Vyas, if you can just show this banner behind me so that people know what we are.
Absolutely. And we see that Hindu Physicians International banner. And with that, we say bye-bye to Dr. Rakesh Sharma and to all of you with lots of good wishes.